Hello and welcome to New Health. I'm an RN here at New Health, and I am the person that gets to talk to all new patients, new clients, anyone interested in our services. They call me and I'd be the one that you speak with. We operate as a provider and nurses that assist in our clinic with your services. You're coming to us to lose weight, to feel better, to have more energy, to look better. All of those things can be had at our clinic. We offer in-office and virtual appointments to make it tailorable to your needs. But we also know that everyone wants to have more information before you jump on a call or before you commit. So I'm here to say what our services are, how we can help, and what is a good timeline for you to get to your goals. So let's say you have an interest in our services, you saw us on Facebook, you saw us on our website, you were referred by a friend, however that looks like, you submit a request through our website. Then you can get the opportunity to sign up for a time to talk to me, or you can just call into our office and they will route you to me. Either way, I'm happy to talk with you, probably about a 15-minute conversation. We're gonna go over medical history, just basic things that you've done that have worked for you in the past for weight loss, things that maybe haven't worked for you, other medical concerns that you've had that maybe are preventing you from being where you'd like to be, and a few other pieces of information that just help me tailor the program more specific to you and help me pick a provider that would be a good fit for you. And what our providers offer is support, accountability, same thing that our staff is going to offer you as well. But it's specifically, once we establish a plan for the patient, meaning nutritional counseling and guidance with prescribing an appetite suppressant, or looking at our Jumpstart program, or a combination of that with hormones, which medications we might use. That's a lot of questions we go over in our appointment, but the basics of it is that we want to make sure that you have all the options available and that we help tailor that to you. So some of the most common questions that I get are around the newer GLP-1 medications, and I'll kind of go over those just briefly in our conversation, but just so you're aware, there's a lot of different names that are out there. Ones that are available to you specifically through our office are going to be the compounded versions, which are called semaglutide and tirzepatide. The name brands of those would be Ozempic and Wegovy for semaglutide, and then Zepbound and Mounjaro for tirzepatide. So there's really only just two different medications we commonly prescribe here at New Health. So that would be the semaglutide or the tirzepatide. The difference is that the semaglutide's been around longer and the tirzepatide has a little newer capability. Other questions that I typically get in our initial call, our free consult, more about side effects and cost. So one of the biggest factors that patients really truly appreciate is that they get to communicate with the provider, nurse practitioner or physician, as well as staff in office. We have nursing staff that will be reading messages 10 plus hours a day, and then there's always the provider weekly text that you have. The other thing that I get, of course, questions about is cost. So the cost structure is a fee for our service plus the cost of any additional medications. So we really have two different plans. We have a Jumpstart program, which I'd be happy to talk to individual patients about that, but kind of our overall basic program that we do is our month-to-month option, which is doing nutritional counseling and guidance with prescribing some form of an appetite suppressant. And that cost structure is $600 initially to get started with us as a new patient, and then it's $120 per month for our services thereafter. What is a service? A service is going over a good nutrition program. It's evaluating a good suited number of calories for you with the provider. It's that communication via text that occurs every week. It's the free vitamin cocktail that you get per month with us. And then it's us potentially exploring other items. So like, let's say you need your hormones tested, or you've got issues with some inflammatory processes, or you've got just other concerns that maybe are not being addressed. So we are a second opinion on a variety of things that we're happy to assist with. We're basic primary care and concierge medicine. Concierge medicine is you get the run-of-the-mill cold, cough, flu, UTI, anything like that, we can usually send in something for you to assist with what's going on or manage what's going on. It's going to vary based on dosage, medications. So we offer the semaglutide, the lesser expensive medication, starts at $60 for the low dose. So that would be for patients who have not been on the medication before or haven't been on it in quite some time. So that's $60 for a low dose for a month supply. That's how we sell our medication. And then the other medication, the trizepatide, comes at $140 for a month supply. And that would be for the low dose. We do also offer other medications, not just the GLP-1s. Some people are interested in just something like phentermine or Vyvanse or some other medication that's a pill route, as I mentioned earlier, was hormones. And so we're always happy to look at your hormones. So hormones can be huge for patients in deciding what the next steps are. So in summary, this is something that, our new health environment and our culture is something that patients really love and thrive upon, and we love our patients just the same. We would love to be able to make and be a part of your transformation and a part of the physical transformation. We do med spa services, we do weight loss, hormones, cool sculpting, filler, Botox, pain management, sexual health, men and women, lasers, laser hair removal, skin tightening. The list goes on and on and on of all the services that we have added because our patients want more. I hope that gives you a great summary of what our weight loss services are here at New Health. I carry my phone because this is where you're gonna call me. You call me directly, you call our main office line and it'll come to me as a new patient. My name is Angela Griffith, I'm an RN. My direct line is 785-410-5245. But our main office line is where most patients find us, and that's 785-215-8228. Check us out on our website, newhealthkansas.com. I would love to hear from you all. Thank you and take care.